And during this pandemic, Hartford Hospital has seen an alarming drop in the number of people who are coming to the hospitals for heart attacks. Channel 3's Nicole Nalepa spoke to a doctor at Hartford HealthCare about the risk of avoiding treatment and how things are looking now that the state is starting to reopen.
So joining us now to talk more about this is Dr. Amanda Zaleski. She is a clinical researcher and a CPR instructor at Hartford Hospital's Department of Preventive Cardiology. So Dr. Zaleski, thank you so much for joining us.
Thanks, Nicole.
So our first question for you is, when did you start to see a significant drop in the number of cardiac events?
Probably at the end of February, early March, we started hearing this anecdotally from our colleagues. So we started examining this, looking at hard objective data using our registry.
And do you attribute that drop in the fear of exposure to COVID-19 or, the fact that people are home and really have no other choice than to just rest and regroup?
Right. That's really hard to say. We certainly know that a proportion of those patients likely were exposed to COVID, so sort of mask morbidity and mortality with COVID. Those patients aside, we have reason to believe that a large proportion of those patients are indeed avoiding or delaying seeking care.
And that's obviously a little bit of a cause for concern, I'm sure.
Right, because we know that the longer that we delay care, the worse our outcomes are, irreversible damage, and then quality of life, right? And so, in fact, we're already starting to see that for the month of May. We are starting to pick up on cases, but these patients are presenting in much worse shape than they would have if they had come at the onset of symptoms.
Well, this week is actually CPR Awareness Week, and given your background and your expertise on CPR, what kinds of modifications would someone be able to make when giving CPR during this pandemic? Because obviously we want to reduce the risk of exposure, but we also want to be able to jump in and into action if it means saving a life.
Yeah, that's a great question. So first of all, pandemic aside, we know that 70% of cardiac arrests occur in the home, and so that number is likely much higher right now. And so any risk that you might incur while delivering CPR really are mitigated because it's someone that you're likely already living with. If not, if we're in the community, the American Heart Association recommends to first appraise your own risk, right? And then if you are to deliver CPR, we're going to be doing hands-only CPR. We know that that's just as effective as mouth-to-mouth with your mask on and the patient's mask on. CPR in and of itself, even doing the compressions, is aerosol generating, and so we want to be mindful of that.
Okay, Dr. Amanda Zaleski, thank you so much for joining us from Hartford Hospital.